Okay, so for this one, you're gonna need a pillow, a small, firm pillow, or a yoga block. So, hug a pillow, or whatever it is you chose to be really close to you. From here, you're gonna find a straddle position, but not your absolute end range because you don't wanna go from there. This is my absolute end range. I have no ability to really lift my legs here. So you wanna slide them so that they're like maybe 20% away from your end range. From here, all you're gonna do, which is actually quite difficult, irradiate in the belly. From here, you're gonna originate from the hips as you rotate both hips down and in towards the floor. Now, one hip will want to go a little bit further. That's okay. For me, it's the left. Then from here, you're going to open up the hip and externally rotate. So we're doing something called axial rotations, where you're rotating deep inside the hip socket, and then you're externally rotating so that you're reaching the knees, the toes, and the hips out to the side. Once you reach them in, you should feel like there's a physical restriction, like you literally can't go anymore. The reason why we're hugging a pillow so that we can maintain tension in the trunk and also stay tall. Something to give us feedback. Leading with the knee, because if you lead with the knee, it's closer to the hip, and that's where we want to keep the motion originating from. But it's a little harder to think about that. So if you think about the knee, it'll just happen naturally. Keep going in, and then out. So keep going, just so you see what's going on. If you look closely at the hip, you can see that I'm moving my thigh, my shin, and my foot in and out. So let's do 4 more, and you're gonna do 2 sets of these. You're gonna do 2 sets of 10 with a little break in between. In and out. In. You keep holding the pillow. Good. Take a little rest, take like 30 seconds, then do it again. You should feel like your inner thighs, your adductors, and all of the tiny muscles on the inside of the leg are pulling you in as you internally rotate. And then you should feel all of the outer hip muscles and the ligaments and the tendons and that whole area externally rotating you and trying to draw the entire hip out, right? So we're really trying to groove deeper and deeper ranges of motion instead of just like yanking at the leg and having the knee take the brunt of it. Does that make sense? Like if this is your hip socket, and you're really trying to get more internal and external, but not the right way, your knee will take the brunt of it. So your knee will try to externally rotate. But we really want the hip to do the work because the hip is the most powerful joint in the body, besides the spine, which is really a ton of little tiny joints together that creates one larger stable joint. So anyway, you get the point. So you're gonna do 10, rest, 10 again, rest.